In our project, we aimed to understand the effects of different levels of physical activity on blood glucose and glycemic variability among a low-income Hispanic population with type 2 diabetes. Our data was collected from 21 type 2 diabetic patients who wore continuous glucose monitors and Fitbits for 1 week, as well as self-reported data from participants. We first aimed to quantify the effect of physical activity intensity level on blood glucose rate of change. Here we have 2 patients, and when intensity and the standard deviation of the blood glucose rate of change are plotted together, the standard deviation decreases with increasing intensity, even though you can see that these 2 patients have different ranges for their glucose variability. We next aimed to predict glycemic variability of a patient based on their daily step count, and this scatterplot matrix shows participants who experience the highest variability in their glucose, greater than 60 milligrams per deciliter, have very few step counts. Most are less than 10,000 per day. We also wanted to predict whether a patient would have high glycemic variability based on self-reported metabolic factors like BMI and the number of years with the disease. Here we used the k-nearest neighbors method, and despite the small data set, it does look like those with low BMI and number of years with type 2 diabetes have low glycemic variability. Finally, we wanted to predict whether a patient would have high glycemic variability based on self-reported sociodemographics, like income and gender. We all used k-nearest neighbors again, and it looks like there is a tendency for lower income individuals to have higher glycemic variability, but variability does not seem to discriminate by gender. The lab values that providers currently use to deliver care don't provide insight into daily variations. However, patient-facing technologies such as glucose monitors and activity trackers offer opportunities for capturing patient behaviors and communicating those behaviors to providers. The methods used in this project would be easy to implement in a clinical setting to visualize the relationship between physical activity and glycemic variability. Prediction models allow clinicians to more closely monitor certain populations at risk for higher than average glycemic variability.